We take you to Rajasthan, where the private doctors are on a warpath, and this has been going on for the last 2 days. They are up against the state government on the right to health bill. Now, this protest, as I mentioned, has been on for the last 2 days, and it doesn't appear that it will be ending anytime soon. The strike is against the right to health bill. Doctors say the bill will hit them hard. Patients continue to suffer, with the government failing to find a solution to the crisis, and doctors are refusing to relent. Most doctors are worried that the bill might force the doctors to give free treatment to patients and that the government will not reimburse the amount. We are joined by Dr. Tushar Dashora. He is the MD and consultant pediatrician and also a protesting doctor, joining us on the broadcast. Thank you, Dr. Tushar, for speaking to us. First of things first, tell us your moot points. Why are you protesting, and what are the pointers that you want to discuss with the state government?
Okay, Pankaj, thanks, and namaskar to all your viewers. So, this is actually a draconian bill, and I'll just put the main points in perspective. So, first and foremost important is this bill is actually a misnomer. The government has brought this bill with the name of right to health, while actually it is not right to health. The bill describes about right under emergency conditions. So, what is the medical treatment you can avail under emergency condition? This is the first thing. Second thing, nowhere the government defines emergency in this. The government has a very widespread a combination of words like a snake bite or a obstetric condition or some random road traffic accidents. So what actually this bill provides people is that they can go to any hospital during emergency condition and ask for a free treatment. And under this bill, the doctor is obliged for three things. One, he has to admit the patient, treat the patient without any cost. That's okay. Second, if the doctor needs because if the doctor is, suppose I'm a pediatrician and you give a heart patient to me, a cardiac arrest patient comes to me, so I'll
Right.
immediately stabilize first and then officially tell him that please we should go to a cardiac emergency center. So this onus of transporting the patient from my center to the other center lies with me. And the third most important thing is that this bill says that I am supposed to stabilize and transport the patient. That also is okay because it is a complete wrong narrative which has been spread all over the media by government that doctors do not want to give free services. It is the bill. The main objection of doctors is not about free emergency services. The actual objection which doctors are doing to this bill is because
Right.
this bill, which is hardly a 45-50 pages bill, it puts extra vigilantism on doctors. It creates a sort of a local health body or authority, rather pradhikaran it's called, which actually judges the doctors whether they are providing good services or not. And this pradhikaran or this authority constitutes of an IAS officer or a person of civil society or a person from NGO and a local neta and a parshad and some political party worker. So, and that people can actually penalize the doctor at the moment for 10,000 rupees first time, second time 25,000 rupees. And further, this bill actually bars the doctor from approaching any civil court for any litigation. So this bill actually is a draconian bill because it is trying to put extra vigilant doctors, trying to, in addition to the 54 existing laws which we are supposed to follow, this will be the 55th law, and this unnecessary creates a tussle between the patient and the doctor. Now I'll tell you why. Why? Because the government actually has done nothing for the last 4 or 5 years. Now that since the elections are approaching, what they have done is they have painted the entire state with billboards saying free, free. And they are distributing pamphlets and they are messaging to their people all over the rural areas, all over the entire state that the government is assuring free health care to all people in all private hospitals, which actually is a big farce. So what happens is when people hear that government is allowing us for free medical treatment of all kind at all places, they'll approach us. But what
Right.
actually happens is, since the doctor has read it well, the doctor says, please understand this is only right under emergency condition. And since this is not an emergency, I can't admit you, and probably you don't need a treatment. So if somebody falls from a scooter and just has a minor scratch, he'll come and say that treat me for free, and you admit me, and you just transport me. So these things will create unnecessary patient doctor conflict. That's the first thing. Number two, it unnecessarily creates extra vigilantism over the doctors. And as I call it a kind of a legislative terrorism, because doctors are educated people. They read over 19 subjects in a plain MBBS. So you can't actually fool them. What has actually happened is everyone has read this bill and they know that this bill contains certain draconian constrictions over us, which are eventually going to force us to either move out of this place or just stop practice. So this is
Right.
a struggle for existence for each and every healthcare worker. So I'm telling you, the bill is not only limited to doctors, it includes the Siddha, the Unani, the Ayurveda, the
Right.
physiotherapist, the dentist, the nurses, even. So
Right.
that's the reason. Yeah, that's the reason. Yeah,
Dr. Tushar,
yeah.
your passion, your demands is evident from what you have just narrated. We are also joined by Dr. Raj Shekhar Yadav. He is a state convener of Upchar from the state of Rajasthan. Thank you so much, Dr. Shekhar, for joining us. As Dr. Tushar was mentioning, the gray areas that are falling under the emergency category is something that is, to cut the long story short, going to prove to be economically not viable for the private hospitals and private doctors. Does the state government or is the state government aware of this?
They are not. If had they been aware of the logistics required for this ambitious bill, they would never have attempted such thing. Uh, Health is a state's responsibility, and to provide triple AQ compliant health services which are accessible, acceptable, affordable, and quality compliant. It's state responsibility, and through this draconian act, state government is trying to shift this responsibility to doctors, to private hospitals, to private enterprises, and this is unacceptable. Secondly, I'd like to read a clause from the preamble of this bill. It says, and whereas every resident of the state of Rajasthan is entitled to enjoy the highest attainable standard of physical, mental, intellectual, and social well being and state of health, which is conducive to living a life in dignity. This bill, 95% of this bill talks about only emergency care. There is nothing about mental health, about social well-being, about clean air, about safe drinking water, about financial empowerment, nothing.
Right.
And I'd like to quote clause number 4, uh, 3D. It says, not only residents of Rajasthan, but also people from other states who are living in Rajasthan, they have the right to avail free health care services from public healthcare institutions,
Right.
healthcare establishments, and designated health centers in the prescribed manner subject to the terms and conditions specified in the rules. So they are announcing free from even private enterprises without
Right.
disclosing the method of payment, how much they will pay, when will
Right.
they pay. So basically, this
Yes.
bill will kill the
Dr.
private sector
Dr. Shekhar.
completely.
Yes, Dr. Shekhar, we get your sentiments and we get your pointers also. Dr. Tushar also echoed similar sentiments, and he also brought us up to speed with the technical issues that are there and obviously the monetary part. Dr. Tushar, one final word from you because we're running out of time. As of now, what is your plan of action? Because we also must take into consideration the patients who are suffering.
Okay, Pankaj, yesterday I spoke the same thing and I'll repeat it through your channel, that we as doctors are accountable only to our patients. Our accountability lies only with our patients. But
Okay.
what has happened is the government is trying to portray this as a story where a villain, the doctor is portrayed as a villain, the patient is being portrayed as a victim, and the government enters in the middle as a savior. And they just try to get some votes out of this. That's the whole
Right.
strategy behind this. If you dig deeper, there'll be further sinister designs which we'll discuss later. But our point is, right now it's a struggle for existence of doctors, and we will go to any length, which means हम लोग इस समय सूली पे चढ़ने, गोली खाने और जेल जाने को तैयार हैं. We are ready to bear any consequences till this bill is rolled back. There is no looking back for us. क्योंकि in any case, if this bill is not rolled back, we are going to suffer. The entire private healthcare system of this state will be pulverized if you continue with this bill.